Quality assurance to Dynalabs is making sure that whatever they put out, the data that they generate and the sample that they generate the data for is right, and that it is reviewed, and that the compound is safe and effective.
Safe and effective. Every medical compound delivered by a pharmacy or hospital pharmacy or manufacturer has to be tested for proper strength and ensured to be free from contaminants. When the government tightened those standards several years ago, Dynalabs saw the need.
A little over 10 years ago, some regulations are being enacted to ensure patient safety, and that created a greater need for testing in the compounding market space. We recognized a potential opportunity and performed a market survey. The market survey revealed a few things to us about the existing labs. They weren't offering all the tests that were required. Their pricing was high and sometimes confusing. Pharmacists were having to wait up to 3 weeks to get their results back, and everything was being done on paper. Test requests, certificates analysis, the whole thing. Generally a lack of good customer support. What we did is we developed a business model that was more cost effective, much more efficient, and presented it to the compounders. In one fell swoop, we simultaneously increased the efficiencies in two markets, the compounding pharmacy market and the analytical laboratory industry. Today we're recognized by our peers as the market leader in analytical testing, and all this, I think, truthfully has been due to us sticking to our core values of patient safety, affordable health care, and business success, not only for ourselves but for our clientele as well.
The major tests we do are HPLC testing, which is a potency test. We also do titrations, which is a potency test. We can use the mass spec, which is another type of HPLC. And then we also offer pH testing. We offer dissolution testing. We offer a lot of different options for people to get potency or purity results for their samples.
A compounding pharmacist is our main customer, and that corresponds to local pharmacies that you see on the street across the country, as well as the retail chains, both at a national and local level. However, in the past couple of years, we moved into the hospital marketplace, and that is a nice situation for us because it really accentuates our quality assurance platform. It's been resonating very well with the hospital pharmacies. They like it because it focuses on diversion of the product, also the regulatory compliance issues they might have, as well as extending the dating on the drug itself.
When the compound is received, the sample goes to two main areas for testing: chemistry to check for proper strength, and microbiology to test for contaminants.
In the microbiology area, it's essentially tested for two things. One is for endotoxin, and endotoxins are lipid polysaccharides that we are sensitive to, and if injected could cause harm. The other thing is for particulate matter, and with particulate matter, if it's injected into the bloodstream, it could cause blockage in the veins or the capillaries. The core thing that happens in the chemistry lab is we identify the active ingredient that's in the drug and determines its strength, and that's called potency.
Patient safety has become a top priority for pharmacies, doctors, and hospitals. Dynalabs testing is designed to make sure prescribed medicine is safe.
We have 2 levels of review in every step. So when the sample gets received in, it is received and it's reviewed to make sure that the compound is labeled correctly, that it is what it is, looking at it. It comes into the lab, it gets tested, it goes to a quality department that reviews the data. They visually review the data. It then goes to a second level of review to make sure that that first review is correct.
If a compound is found to be failing in any of the tested categories, Dynalabs does much more than just issue a failing grade. A large part of their business is devoted to finding out what might be causing the problem and helping the client to correct it.
We offer not only the testing, but also the consultation of what that testing means to them. So in their process, we only impact them right now, but also down the road, because that consultation provides them an opportunity to do something better next time they compound a drug.
We're a solutions-oriented company, and what that means is if we give a failing result to a customer, we've actually given the customer a problem. And when we give a failing result, we also give them what we call a solution. And the way we get to the solution is by talking to them. And within usually 10 to 15 minutes, we can identify where the problem is in their system, give them the solution to fix it. They can prepare another sample, send it back into us, and test it.
Fixing the problems of out-of-spec samples falls on the technical service representative. That's the job of Lauren Doctor.
When there's a problem with the sample, the first thing I want to do is I want to see the formulation. I want to look over what they weighed out, how much, what the process is. Then I really want to get into what the process is all about, find out exactly what they did step by step, as well as talk to the person that made the sample to get all of those details. So with all that information, I can talk to them and troubleshoot where that issue came from. Being a quality assurance company, we really focus on the quality of the samples that we receive. So if we notice that there's an issue with the quality, we definitely want to help the pharmacies figure out where that's coming from.
Getting started as a new client begins with a conversation. Kelly Smith is the Dynalabs account manager.
First, what we do is we ask them a little bit about their business. So do they do mainly sterile products or injections, or do they do non-sterile, so creams or capsules? So we ask them, what's their business like, what forms they compound, so capsules, creams, injections, things like that. Then we look at their concentrations. So we go into this detail, we look at how their business is set up, and then we create a testing plan that's tailored to them. Because of the services we offer, they tend to stay with us just because they get a lot more than just a result. They get a solution. So we really take the time with them, and if they're in an audit situation, they call us, we pull data for them, and we really help them and kind of handhold them if needed to be there for them whenever they have audit situations or whenever they're looking to get more business. We help them and guide them to do that.
This is the Dynalabs Centers of Excellence map, kind of a hall of fame for clients who have signed on as a CQI partner and have demonstrated excellence in following Dynalabs' stringent guidelines. The CQI map also provides a list of certified safe suppliers, as well as a reference for customers who may need outside services.
I think the people that we have as the foundation in the lab and also the supporting group from the customer service and sales perspective, we all have that one quality of wanting to make the quality of the drug better in the customer's eyes for the patient safety piece of it.
We can leverage the data that's generated in the testing process to become more of an information management company, and we're doing a lot of that now. We help our customers understand how to leverage the data that's created during the testing process, both to market their business to their customers, but also to use that data to make themselves better as a company.
Quality assurance, ensuring that prescribed compounds are safe, free of contaminants, and of a proper strength. And if adjustments need to be made, following through with the client with the right solution. Dynalabs, setting a new standard in the ever-changing world of drug testing. For a consultation, you can register on their website, dynalabs.us. The safety of your products is our highest priority.